the Brothers and Sisters, which is a new nonprofit which my friend and I founded um, that concentrates on queer liberation and immigration. Um, but yeah, I'm happy to be here, and especially I think the theme here is something I've been kind of doing a lot of soul searching, and I've been having a lot of journey with decolonizing my mindset. So that's been my theme this whole year alone, and I feel like when we're talking about freedom, I think it's very important, and I feel like that was something you know I'm kind of willing to share a lot of that theme.
Good afternoon, everyone. My name is Dr. Ima Ahonkai. I am an infectious diseases and HIV doc at Mass General as well, and at Harvard Medical School. It's a real privilege to be here today. I have, my pronouns are she, her, hers. When I saw the theme for this session, it really spoke to my heart, and I think that you asked about what gets us up in the morning, what gets us up, what brings us here to this work. And I think that imagining freedom now in this climate, in this environment, is itself an act of resistance and empowerment. And so thank you
Yes,
for,
having a free mind.
for bringing us together today under that platform. I also want to say that for me, an African American female, less than 3% of physicians in this country are African American women. And so what also brings me to this space, to this room, to this work is a sense of personal responsibility. And I think for so many of us, the work we do is personal. And I can't say that, I have colleagues who I respect so much who don't necessarily look like me, and I think that they don't understand how personal the work is that we do. So that's what brings me here. That's what motivates me. I'm really happy to be in this room with everyone today. So thank you.
Good afternoon. My name is Shirley Royster, and I've been around for a long, long, long damn time. I first started out at a program called Positive Directions. And Positive Directions was a program that went into the schools, went into the schools to educate the children of the Boston public school system. We were there, we walked in, and we surprised the children because we didn't look like we had AIDS. And we did have AIDS. All of us that spoke had AIDS. All of us told our stories about living and thriving with HIV and AIDS. We also told them about prevention. We told them about the programs that were available to them. And this lasted for about 5 years. The program dispatched because there was no funding. I also am part of the Boston Public Health Commission, Ryan White committee. I'm also part of the Department of Public Health Consumer Committee and also the Intervention Planning and Policy Committee. I've also worked on the programs that are at the Living Center. I've worked on programs that are at the Fenway. As a matter of fact, the Aging Project recruited myself and Paul Glass to come in to give them some ideas of how to integrate into the people of color community. And that's how we got started with the Aging of Color, the Elders of Color program. We have been in existence now for almost 10 years. The one thing I want to get over, and I'm not going to talk a long time so I can accept questions, but I want you to know that it's really exciting to know that in this community, it's now time for us to embrace everybody in this community, the older, the younger, and even the infants. because we are all in this together. And if we can't start communicating and trying to help one another, this is not going to work. We are not going to make inroads into who we are. Thank you.
Hi, I'm Finn Gardner. My pronouns are he or they, and I'm the advocacy and organizing manager of the Massachusetts Transgender Political Coalition. And our organization advances the civil rights and lived equity of trans, non-binary, and gender non-conforming people across the state. We do a lot of legislative advocacy. We've been prioritizing several bills this year, one of which has just been passed. We supported a bill that would makes legal name changes more private. Like in the past, you had to publish your legal name change in a newspaper, which is really dangerous if you're trans or a survivor of abuse or domestic violence, because you have to put your information out there in the public, and name changes also were public record. You could look somebody's name change up, you could see their address, their email, all kinds of personal information. And that is no longer the case. The governor just signed this into law as part of the supplementary budget, so there's no more publication requirement to legally change your name in Massachusetts. So that's our big win of the year, and we've been doing other policy advocacy work to try to make people's lives more fulfilling, to make sure that there's justice and equity, and kind of pushing Massachusetts to push back against a lot of the hostility and hate that's been emanating from the federal government ever since this travesty of an administration took over.
All right, I want to thank all of our panelists just for introducing yourselves and for just giving us a little bit of background. You guys are all very amazing people, and I'm glad to be in connection with all of you, for real. So I'm going to remind everyone of the questions that we have around the room. So these questions are going to drive this conversation with our lovely panelists and with yourselves. This is where we get to share what we may have wrote on these walls before we got started today. So just to remind everyone of our questions, first we have what worries you the most for your community? We have, what does it truly mean for LGBTQ plus people to be free? And I will add, since we are here focusing on our LGBTQ communities of color, what does it mean for our communities of color that are LGBTQ to be free? Let's think about that too. And what is the future you imagine for us? What are the resources we need in the community to make happen, to make it all happen, to make our visions come to light? And what steps do we take to protect LGBTQ safe spaces through legislation and through policy? So we had everyone kind of answer some of these questions, share their thoughts. We're going to get back. I know I saw a lot about, worries of fear and division in our community. I was kind of taking a look around before I got back up here. I saw a lot about decolonizing our minds and decolonizing in the type of spaces that we're creating. Talked about a lot about community spaces, what we need there. Just again, connection between elders and young people, and creating big spaces where young people do not have fears. I was seeing some of y'all's. So I want to now, first I'll bring it to our panelists.
Keystone, please come downstairs. Keystone, come downstairs.
Oops, sorry about that. So I'm going to first bring the questions out and just have, first I'll start, I guess, with what worries you the most for your community. I'll bring that, and that's really something I kind of want to hear from everyone, but I'd really like to, maybe I'll bring it to you, Finn, first.
Okay.
I'm picking y'all out randomly a little bit. But so what worries you the most for your community as we're thinking about our LGBTQ communities of color?
I'm worried about a lot of the federal actions that have been taking place lately, ever since Trump came back. And I'm also not just concerned about him and his and what the executive branch can do. I'm also worried about the Supreme Court. because there are some cases up in front of the court right now that have to do with trans rights. For example, the right for trans youth to participate in sports that match their gender identity. There's also a case about passports that's going through the courts right now. And if anything, you know, I don't think that the Supreme Court will, I think it's highly unlikely that the Supreme Court will rule against us, and that might cause some really terrifying precedents to be set.
Yes, very important, especially thinking about the way decisions are made in our Supreme Court. That really changes law. And there's a lot of cases I feel like that are kind of coming up and that people don't even know about, like cases that are just coming up from different states that are just making their way up to a federal Supreme Court. We don't even know that something is about to get changed. So thank you, Finn, for calling that out. Could I have maybe one more person? Tariq, I'm turning it to you.
Thank you for asking me this. I'm fully prepared. No, I am. I like last night, because I find myself, I get on panels and I'm like, and then after I leave, I'm like, that's what I wanted to say. So I wrote down what I wanted to
Keystone,
say.
please come down, stop decorating, and get downstairs now.
Oh, somebody's really in trouble.
Keystone is really.
I'm scared for Keystone. I'm not even scared for us.
But what they decorating?
Right.
I'm sorry, y'all, we are still in a community youth space right now.
And I love that we're in a community youth space too. It's actually my favorite space. I love community and youth. What worries me
Worries you the
most for
most?
my community that I'm in, most part of is like ballroom, but mostly just black and brown folks, people, youth, that are like entertainment spaces and stuff like that. So my worry is that, I'm gonna say, my worry is that we'll never let go of the crabs in the barrel mentality. So there's always a slight divide in like everything that we do out here sometimes, even when it's done with best intentions. But the thing is that it seems like everybody wants to be the leader all the time and no one wants to like follow. And not realizing that if you don't first learn how to follow and really saturate yourself in the field first, you can't really be an effective leader. You know, if you go straight to the top, how can you be empathetic to those that are not necessarily there at that time? And there's nothing wrong with going straight to the top either, right? But we still need to be humble and always willing to learn, not feeling like we have the answers, all the right answers to everything. There's a proverb that says there's success through many advisors. And so instead of us trying to one up on each other all the time, thinking that we have impure motives, it's nice when we can all work together and learn from each other, like we were just talking about earlier, and then we will have real success.
Okay, thank you for that. Thank you for those first two comments. So now I just want to bring it back to our virtual audience. Do we have any comments? Okay, so we'll bring it back. 420? Amazing!
Work 420. Can we get some hand sanitizer up here, please?
Yeah.
I need hand sanitizer because my hands smell like the state. And I almost tripped. I'm like, I know what.
We got
Okay.
some hand
I need some hand
sanitizer. Okay. So, well, first, so Adriana, do we have any comments right now? We just asked two of our lovely panelists, Finn and Tariq, about what worries them most for their community. Tariq spoke about what worries the most for the Black and brown LGBTQ community, the ballroom, the entertainment community in general, youth that are involved. And Finn talked about worries just on a federal level, policy level, things that are coming up, or even on a state level. So do we have any comments even from that, from our online audience?
Hi everyone. Can you hear me?
Yes.
Hi. One thing that I'd like to bring into this space and conversation is the worry of how society and the systems and structures around us really promote this that takes our attention away from being together and unified and really accomplishing the work that we need to do. And so
we're taking so much time trying to manage the conflict within ourselves that we don't see like the bigger issue, the bigger problem, the bigger container that we're in that actually we need to come together and address together. So that is the biggest worry in our community, that we are so occupied with fighting each other that we don't see the real work that we actually need to come together and accomplish.
Wrap that up. I'm like, yeah, that's exactly
Right.
yeah, the
Right.
layers. There's many layers to that.
There is. Did we have any other comments before I take it to our in-person space? Okay, so do we have any comments just with that first question, or what Tariq or Finn or Adriana said? Do we have any comments or any follow-up questions or responses to that? Not
So
at
anybody
this
want to answer what
time.
wakes you up in the morning, what gets you your blood flow?
That as well.
Yeah,
We
you can
could
go if you want.
introduce that question.
Yeah, go, yeah.
Okay.
Absolutely.
Well, I wanted to speak to a large worry that I've been encountering and hearing from other folks as I speak with them in the community, is that a worry is loneliness. There's a large epidemic of loneliness that is creeping up and amplifying within our communities, where people feel as though they are alone, that they are solitude and they are on their own. And it takes folks like us who are leaders in community, and also folks who are a part of community, to reach out to folks and make sure that they understand and know without a shadow of a doubt that they belong. And when it comes to all of the things that are happening in the Supreme Court, or other governmental things that are trying to take away our freedoms, this is the time when, now more than ever, we need to make sure that people know that they are not alone, that they are supported, they are uplifted, and that somebody out there got their back.
Thanks for that. I know, I feel like that's such a big buzzword, like online nowadays, loneliness epidemic. I feel like people always talk about it with like a male loneliness epidemic, turning people into kind of, what's the right word? Very red pill content type of things, or what's growing with a lot of like alt-rights ideologies with our youth online. So thanks for bringing that up. So I think I'm going to, do I have another? Oh, Dr. Ima, yes.
I think what worries me most is a combination of not learning from our past and comfort. And so I think a lot about how did we arrive where we are today when we think about social determinants and structural racism. And we all know kind of the history of how this country was founded basically on oppression. And this is the result of that, is all the social determinants and things that we were talking about before. And then as an infectious disease doc, we went through COVID, the COVID pandemic. And I think a lot about, okay, well, we now have education loss, loneliness epidemic, so many consequences of the COVID pandemic. And during that time, I was thinking every day about, okay, is this going to stay with us? Will we remember what we're living through in a year, in 2 years? Because what we did during COVID and what we didn't do during COVID and what we didn't do before COVID left us with these educational gaps, these health gaps that will take generations to recover from. And then here we are now in this political climate. And the damage that's done now, again, will be amplified for years. And so what I think about is, how complacent will we be in the moment? How much will we learn from the losses we've had on these, serial kind of tragedies? And so that's what worries me most, is making sure that moments like this, opportunities like this, collective action is still very much at the forefront for our communities.
Thank you for sharing that. Did I have anyone else? Yeah.
You really unlocked something in me, doctor, that I just wanna, I'ma just project, acting school, okay. You unlocked something in me, which was, I took this online course about foundations in government. It was a free online, thank you. It was a free online course from through Harvard. And it was asking, what are the threats to democracy? And it was one of the biggest threats is when all branches are united against the common good. And right now, we are living in that very moment. And of course, in these online classes, we have these discussion posts, and people were kind of talking around the fact that white supremacy has always been. And so I was the girl in the chat being like, so is no one gonna talk about how this country was founded off of a feudal system of made by white supremacy, that they utilized and said, we want our own freedom, but the only freedom that they knew was oppressive system. So they implemented that here. I get worried that we're going to start continuing to think that thank you, Vincent, these performative gestures of activism will save us. They won't. They actually will just continue the harm, which I appreciate having and seeing the numbers of a No Kings protest. But I also would appreciate that same energy in a State House room when it's time to vote on a bill that's gonna protect our community. And I think what happens is, like you said, we can't forget. I think when we have an administration that is on our side, we don't hold them to the same fire as we do with an administration that isn't. And so I guess I just worry more about how we show up and fight back against the systems in a non-performative way. I think it's often easy to just go, well, we're gonna protest here and then we'll see y'all next week. What has been accomplished? Did they make a change? If this organization is still doing what they chose to do, there's now a different tactic. And so I just get worried that our community may follow a one-track mind when there are so many inventive and creative solutions to fight systemic oppression. And I think it's about working collectively, like you said, that collective action. And like you were saying, letting people know you can follow and that's okay. And it's okay to learn and not always be right. I love not knowing what is happening sometimes because then I can be educated and I can educate myself. But I think what is happening now is that I see so many folks fighting to be right and be the only answer to a solution, and that's not how you combat fascism.
I think it's over that side of the room. Give me 1 second.
Yep. Shout out to my co-host, Curtis, working this room.
Resources over here. So we have jobs, housing, guaranteed income. Anybody want to own it? Moving forward. Us in positions of, I think this says appreciation. Opportunities? Thank you. That was you, August. You want to own it? More understanding and knowledge. I have decolonization again. Youth need the wisdom of elders. Elders needs the energy of youth. I love that. Restorative circles and decolonization practices. And I'm going to do one more. Education for us, by us, right? Or for community. Okay, got it. Great. Anybody want to own it?
All right, does anyone want to make any other comments, any follow-up comments to what they put on this board?
I have one over
with
here,
resources?
Mari. I'm going to run down.
Okay.
I feel like the price is right. I've been feeling like AJ, price is right.
Hi, everyone. Hi.
Hello.
My name is Josh. Mine was
Josh.
I'll stand. Okay. Thank you. Okay, my point was about education for and by us, because I'm a student at Harvard, and that education is not for us. It's not for people of color, not for poor people, and it's been very discouraging, honestly. And it's honestly, that type of education is honestly type of indoctrination into like these colonial and white supremacist thought processes. So I just really wanted to elevate education for and by us. It's the only way we'll get to liberation.
Absolutely.
Yes, thank you.
Thank you for being here. I'm Mario. I'll turn it back over to you.
So I guess I will turn it back over to our panelists again. And let's take it to the second question about what resources do we need in particular.
Oh, okay. I will, okay, I want, building on the theme of for us, by us. And I spoke with some of you in the room very recently about this, but we have been working on a program that I think illustrates the power of for us, by us, where we have been working with barbers in our communities to be frontline community health workers. And so I think that resources that put the education in our hands, that provide the resources to do the work, not asking us to do the work for free, that don't silo power or silo information, are a really effective part of resources. So we were doing this work in Tennessee, and we're trying to do this work in Massachusetts, and trying to make sure this work is being done across the country, because as we've all been saying, you know, that we have to be at the table for ourselves. So empowering, putting the resources where our communities can access them is something that I think is really, really, really critical for this conversation.
It's important. And it's that Cutting Out Stigma program. That is a program that Dr. Iman's referring to, is very beautiful program, and I really do look forward to us really bringing that to our local barbers here. And I'm so thankful Curtis was also in that room. We were just talking about this and just thinking about between, because we know we was kind of bringing up a little bit in that space the difference between the experience even in barbershops for Black gay men versus heterosexual Black men, and really trying to bridge the gap, because it's not going to be the same approach. It's not going to be the same approach. So I'm really excited to kind of move forward with that, and also get more community involvement around that. So just wanted to speak to that a little bit more.
Also, educating the folks too is really important. Sorry, Ms. Shirley. I was actually saying that educating folks in barbershops, cosmetologists, and barbers are truly important, Dr. And I truly appreciate you bringing this forward, because they are the first contact to community. And so when you sit in the chair getting your hair done, you have these frequent conversations. So to be able to educate them about HIV and AIDS and have them as a preventative factors when they do their work is truly important to the culture.
I think that it's really important to educate our community, but I also think it's important for you all to know that there is a body that you need to be sitting at the table for, to talk about the money and to say what you need the money for. There are two programs. There's the Department of Public Health and there's the Boston Public Health Commission. Get on those committees, get at the table, and say what you want, because for right now, we are sitting there and they are just doing the same old, because I don't see your young people there. I don't see you there. You have to be there. The trans have to be there. We all have to be sitting at that table, because they get the money. We don't get the money. You have to sit at the table where the money.
You want a mic?
Paul, get Paul.
We have one in the back. No, you're right though.
So, I would like to ask the panel, you don't hear too much talk about HIV these days. Is there still an epidemic out there? how come we don't, I know there's medications and stuff to keep you healthy and all that, but how come we don't hear that much about, I don't sit down with my friends and talk about HIV. So how do you pose that we do this? You know what I mean? We're not accustomed to doing this anymore. You don't even see anybody sick or you look like they're sick like we used to be. So we don't even think about it. We think more about COVID, I think, than HIV. So are you up here trying to get us to be more aware? And I commend you. It's so diverse, East Boston, everything, you know? So, but why are you here? For us to do what? That's what I'm a little bit confused with. Thank you.
No, I'm gonna go to Tyreek, then I'm gonna go to you, Christian, all right?
I'm here because I was invited. No, sorry. No, that isn't true. I do have a seat. I got invited to sit at the table. And so we're sitting at the table. From my experience with a lot of places, I hear somebody that works at Fenway that I'm close to, she uses an expression that a lot of people followed the money, not the disease, right? And so there was a time when a lot of funding was being cut, and then HIV wasn't at the very top priority of what was going on. And for funding, you have to apply for a certain funding. So a lot of care went into other different directions. And so which is not necessarily a bad thing, because now we do have meds, and we do have PrEP, and we do have PEP, and we do have more measures than what we needed before. So I think the conversations are still happening, which is why we're in these spaces right now. I think, and there's still a need. I think it's just not at top priority, whatever level anymore, because it is still an epidemic, but we're not where we were at before. And we don't want to be there, right? Like, it's actually great that we've come to this place where we're now talking about sustainability versus the mortality of it, or like the morbidity of it. And so it's nice that we can sit on this side. And so now I think, even for me, with working at Boston Glass in different places and doing HIV prevention, and like coming from the ballroom spaces, my kids are overly saturated with HIV testing. There's a ball 1 month and then they got tested, and then there's another ball 2 months after that, and then they get tested again so they can get in for free. And like, now we've been tested 1 million times, and like, what's next? And at the same time, I have people in my generation, good close friends, that have passed not from HIV-related complications, but from cancer. We're not talking about that as a whole. Am I no longer on? I can project. Can y'all still hear me? Yeah. I know you can. I already know you can anyways. That's the real tea. Yeah. Oh, am I back? Oh, yeah, the voice is on. Royale, I see we're gonna segue to you, boo, after this. Okay, I got you. Oh, am I talking? Oh, okay. So, yeah, it's time to start talking about our health as a whole. There's a lot of us that don't even have primary care doctors. Like, we know where to get tested. We know where all the testing sites are at, but we don't know where to get a primary care physician. And so these are the conversations that I feel like we need to be adding on to, which doesn't take away from health, because HIV prevention and care is our health. But that's not just it, right? Like, we have to start expanding that and start following that and looking at everything as a whole, because there's so many different things going on with our bodies that we don't even know fully. Like, even when PrEP came out, like, PrEP was great, and it is great. It's been saving lives. And when PrEP came out, then the STI rates went through the roof, because everyone was like, well, I don't need no condom. Like, hold on, boo. You do, because there are other things going on. But when we just focus on one thing, that becomes a focus, and we don't focus on it as a whole. So when we're able to focus on it as a whole, which is what I feel like this conversation is about, with this panel feels multi-generational, very intersectional with people of color, which is amazing, which is what we need too, right? Because sometimes we have different panels, and it's like, oh, okay, we have the white man, and we have the black man, and we have the Latino man, and we have the Asian man, and this is what we need, because this is amazing, and this will bring everyone back together, right? But we don't do enough of those intersectional things within us, because we don't all have the same experience. I didn't go to college. I don't know anything about being college educated, but damn if I can't sit up here and talk like everybody else is too, right?
And at the same time, someone else in here or wherever that didn't go to college and is not college educated, they need to know that, yes, you belong at the table too. You know why? Because the people at the top need data from us. They need our data. We don't realize the power that we hold. And so it's good for us to all be sitting here at this table. I forgot what we were talking about.
No, you're good.
Okay.
You brought it home.
Okay.
And you scored.
All right. So the prompt is about resources, right?
Yes.
Okay,
Yes.
okay. Yeah, I mean, I feel like as a case manager, I'm always connecting people to resources. But, you know, I've been in this field for many years, and I've slowly seen resources get cut. So, because there used to be a lot more resources in the 2010s than what we have now, especially when it comes to HIV services. There's been defunding now for dental and housing, because that falls under Ryan White Part F, and I feel like every time they do any budget cuts, it always hits the F, and that's housing and dental. So like, I also think that support groups, there's not that much access to it, especially after COVID. Yeah, I think that right now we need to. I think a lot of people are detached about people take what's it called? People take for granted the resources that they have. So yeah, and I feel like because of that, people just assume like everybody's good. But then and a lot of people also don't always speak up. I mean, people are dealing with their own struggles, and and so everybody gets distracted, and therefore everybody's fighting their own battles because of lack of resources. But there are resources out there. But the best way to do that is to work as a community to link everybody to those resources, so that we can all be living our fulfilled lives. And otherwise, we're just getting through every day. And I feel like there's a lot of people that are experiencing that. That's a lot of people's realities, is that not because of lack of resources, because here in Massachusetts, in the Commonwealth, we do have a lot of resources, but a lot of people don't know about these resources. And yeah, we take for granted. We're like, oh, doesn't everybody know about PrEP? Doesn't everybody know about U equals U? Like, people don't know that. Like, how does people not know about HDAP, like the HIV drug assistance program? Like, a lot of people don't know about that, and how they have a premium assistance for a private insurance with the Health Connector. Like, that's huge. Like, people don't know about a lot of these benefits that are out there. But yeah, I mean, yeah, I think the knowledge for resources is very important, and also how a lot of the social media spaces, how much they take a huge role in this, because that's how people get connected.
Thank you, Christian. I'm gonna go to Desire.
So I want to just say, I want to approach what you were talking about when we talk about holistic healthcare and what holistic healthcare actually looks like. Holistic healthcare is not just getting someone tested for HIV and STIs and it ends when they walk out of that door. It's about addressing the needs of the client while they're still sitting there. It's about saying, okay, I can connect you. You live in Dorchester. I'm going to connect you to Cotman Square Health Center. You live in Mattapan. I'm going to connect you to Mattapan Community Health Center. It's about making the connection, doing the work, and having warm handoffs. We wonder why STI and HIV is still prevalent within our community. We're not taking care of the holistic approach. We're not understanding why people are doing the behaviors they're doing, because 1, we're not worried about mental health. 2, we're not addressing substance use. And 3, people are here for a check sometimes. And my whole thing is, we have to do better as a community. We all have to stand together, and we all have to be in the fight together. We've come a very, very long way, but it's time we take that next step and we stop addressing holistic health care.
Amaria, you're going to bring us to the next question. So we have one more question, and then we're going to actually wrap it up, as we all should be doing.
So I just wanted to make sure before we left the space that we discussed the policy question, because a lot of this we got to put through action through our legislation on a state level, locally, on the state level, and federally. So what steps do we take to protect LGBTQ safe spaces through legislation? Whether it be petitions that need to be created, bills that we should be getting behind. I want to first bring this back to Finn.
Finn, I was going to say that. I was like, that was Finn up Finn Valley. The mic's not working, but as you talk, the online folks can hear you.
Okay, great. So right now, MTPC is working on a few different pieces of legislation that will help protect our community. Right now, we have a bill that's currently with the Senate Committee on Rules. It's an act establishing a commission on the status of transgender people. And this bill would create a commission on trans folks. It would investigate cases of discrimination. And like right now, we have a lot of laws that protect trans people in Massachusetts. We're doing a lot better than a lot of other states. But the problem is that we're still facing unacceptable discrimination. We are still dealing with hate crimes. We are still dealing with threats to trans people's lives, safety, and happiness. And stigma, and discrimination, and hate, and harassment, and abuse. Every month, we get emails and reports from people who say that they've encountered discrimination on the job, or in healthcare, or by government agencies. And we have to respond to while incarcerated. We have to deal with all these responses. And having a government agency investigate some of these cases of discrimination and conduct research on the status of trans people would make our lives a lot easier. There are only 6 of us in my organization, and it's mostly me tracking this stuff. Having the teeth of a commission would be incredibly helpful, and make sure that our laws are as good as they're enforced. So if you are interested in advocating, I encourage you to look up the Senate Committee on Rules and contact those senators that are on that committee to make sure that that bill gets voted out favorably. It's an act establishing a commission on the status of transgender people.
Thank you.
Anyone else about the policy question? How do we move in policy? Yeah, sure. Absolutely. Just talk to the thing. You might not hear yourself, but it's going.
Oh, all good. Thank you, Finn, for all that you and MTPC are doing. I was so happy to testify for y'all because the people were not ready for us to show up. So we always have to give the people a gag and be like, wait, they're here. Yes, we are, and we've always been here. And also at a local level, the city of Boston has now created a sort of, the word isn't an oversight commission, but it is a commission for the queer and trans community to work with the Mayor's Office of LGBTQ+ Advancement to really put into law the things that we need to help redirect funding to the places that we need and see fit. And so there is gonna be nominations through different communities, some of the counselors, but also through the community itself. And so that information is gonna be coming out very soon, most likely in 2026, early January. But the mayor has signed it. It was run by Councilor Mejia, Braden, and Santana. Chastity Bowick, our good sister running the Marsha P. Johnson Institute, was the chair before she went to Mejia's team. I also have to shout out Mickey Jones, who co-chaired that with me. It is important to be aware and watch your city council meetings too, because there's more coming. We're gonna be holding the Mayor's Office of LGBTQ+ Advancement accountable for much of what Finn is talking about, and also to make sure that our people who are giving care locally get the funding and resources that they need. If we can build White Stadium, we can take care of our people, but that's it.
Thank you for sharing that, and I think we're gonna have to wrap it up right now, but I honestly, even after this, I wanna have some way to even share more of what was on the wall for this question and for the other questions, thinking of ways to share that on social media even after this event, because there's just so much to talk about within these subjects, especially when it comes to policy in this council. So I know we had a couple of visuals that we wanted to share related to our partners at Pride Extended. We don't have time. Okay. So now I think we're just going to wrap it up. There was a lot said, and Curtis, if you have other points of reflection, please share. I just don't want this discussion to end, but I know people got other things to do with the afternoon. I think one big thing that people were calling out in a way is having more community action boards, advisory boards for organizations like the MAC, and actually just having more abundant community action boards connected to our health centers, made up of some of us that are in this room. So I know, taking on myself as one of our program managers at the MAC, I know we've talked about some sort of ambassador program, a different kind of group of people that would be empowered as ambassadors for what we talk about at the MAC in terms of prevention, health navigation, kind of training up people with these resources. Similar to kind of with Dr. Ima's Cutting Out Stigma program, training up and empowering those local Black barbers in Tennessee. So that's something that's in my own mind for after the Happy New Year. MAC is on 9 Palmer Street. As for other people who do not know, the website where you can find ways to make an appointment, consult about PrEP navigation, STI testing that we have every day. We connect with a lot of organizations, mainly Boston Healthcare for the Homeless, for that connection to a primary care provider, someone to help with insurance. But if you need more information about the MAC, come on down to 9 Palmer Street, right here in Roxbury. Our peer support program is actually on 56 Warren Street, right here as well in Roxbury. And our website is mac-boston.org for more info just about all of the services that we discussed. And come on down sometimes. Share what you need to share things that you would like to see happen, or just to come visit us and just say hello.
And I just also want to say thank you to our panelists for joining us this afternoon. It has been great having you at the table, sharing your expertise on how do we navigate through, how do we reimagine freedom as LGBTQIA people of color. Also, I want to thank the audience, those who are virtual. Thank y'all for being here and being participatory in this Imagine Freedom Summit. Remember, I would say this before, we ain't leaving yet. We have 2 more things to talk about. But those who are online, those who are in person, make sure you bring someone next year, because this is only the first year, but we have another year next year happening of the same thing. And so make sure you bring a friend on next time. Make sure we fill this room up with a lot of people that looks like us, that we can have. Every 6 months? Ooh, I don't know.
That's real
too.
Listen.
Listen.
I like that.
A little check-in, yeah.
Right. Yes. Exactly.
Yeah, absolutely. I agree.
Yeah.
No,
Yeah.
I appreciate that. And I think,
feel
maybe that's a way that we could draw into the Max Drop-In Center space, right? Where we talk about how do we create that community action board. It could actually be used through the drop-in center at the MAC. And so trying to figure out how do we figure out the little pieces that make it happen. I think that's really important. So thank you to our panelists. I appreciate y'all. Thank y'all for doing y'all thing. Hold on. Wait.
So we do have special gifts for our panelists. On behalf of Gilead, we want to say thank you all so much for being here. I was going to pass out gifts. I'm going to start with Amber. This is my niece, y'all.
Thank you, niece.
And I want to, but I'm, I want, okay, and she loves to dance. I want to allow the panelists to say any final words that they want to leave us with, and then I want to invite up Paul Glass. There's one more thing. Paul Glass, who will give our final word and close us out. All right? Okay? Panelists, any final words?
Oh yeah, somebody else talk up in here. One of the questions that I had, one of the answers that I had to one of the questions of like, what does it look like for freedom? Have you all seen High Horse? The story of the black cowboy?
No.
First of all, I'm gagging. That cowboy started out as black people, and I never knew that. No, I'm dead serious. I never knew that. So that was nice to learn. Thank you. And so it's interesting that something that they said in there was like, for black folks, for people anyways, for people in general, the United States of America, what it means to be free, or freedom equals land. We don't have no land, y'all. We don't have no space for us to call specifically our own. Only the MAC is what we have. And then what else do we have? Maybe there's something that we all collectively come to all get us a piece of land so we can all really sit at the table for real. Then we can all include each other. Then we will all be invested in what each other has going on. We will all be well informed what is going on. And that way we can all create a big, a sunshining day. I don't know. But yeah, that's my last piece. We got to get us some land and be invested in each other.
I like that.
Anybody?
Hey everyone, once again, my name is Lam and I'm with Frolic, and I also wanted to talk a little bit about the question about what does it truly mean for us as LGBTQ plus people to be free. And for me, freedom is linked to two words, time and joy. The time that as we don't have some land, we also, sometimes all we have is our time. Most times all we have is our time. And so when it comes to being free and experiencing freedom, it's linked to how we can have these resources so that we can best amplify our joy and contribute to our joy too. So whether that joy is our access to health care or financial literacy, all of those things either amplify our current joy or contribute to the development of those joys. So as you go out from this place, please hold on to the words that were spoken amongst folks who are living real realities when it comes to wanting to be free, not just individually, but together.
Thank you.
Hey, this is Christian again. So speaking of land, I mentioned earlier I'm part of an organization called the Community Land Trust of Chelsea. We're part of a larger community land trust network, which is the ultimate goal is to get affordable property ownership. So pretty much in a nutshell, it's like socialism for ownership. But yeah, if you want to hear more information about it, let me know. We do have a Facebook. We're on social media. And also in terms of like, finding freedom, I think that part of it is education and history. I feel like getting really familiar with history because some things we don't realize what happened before our time. So I think when we start learning those things, a lot of things start to make sense. And I know I've been doing my part. I'm learning a lot of history, especially from where I'm from in Peru. And yeah, I think it's very important because sometimes not all of us have those resources, but now that we live in a digital world, we do have access to those that knowledge, that history. So it's just seeking it out, whether it's on YouTube or going searching out for documentaries, journalists, like archaeology. Like there's so much information out there that you can. But also it's good to tell that good to know that you should be careful because there are some misinformation out there. So just keep an eye out for that. But I think that it's important.
Anybody else? You guys, last words? Anything last words, Shirley? Miss Shirley? No, I'm good. You're good? How about you, Finn? I'm good. You're good? At this time, I say thank you to our panelists for joining us this afternoon, and I'll turn it over to Paul.
Thank you, Curtis. Thank you, everyone, for being here. I'm Paul Glass, and I'm the program coordinator for LGBTQ plus Elders of Color. And one of the co-founders of EOC, as we call it. I want to thank this wonderful, powerful panel, and appreciate all of your remarks, and appreciate the remarks from the participating audience today. This has been a special event. It's one of the first that has happened in many, many years that I can remember doing the work around HIV and AIDS over the years. Being involved with elders of color has been a privilege for me, but I can tell you it's been more heartwarming when we are able to be in the space and do the work that we do for our aging community. Our LGBT BIPOC community had, for many years, become invisible. We didn't know, we didn't see one another out and about very often. And one of the things that we did with EOC was to bring a community together. We were, over a dozen years ago when we came together, about creating events and educating our community, particularly elevating the awareness that we, as our aging population, we still exist. We may be aging and become seniors. I embrace being an elder. And I encourage those who are my age and older to embrace it as well, because being an elder doesn't just mean that you're old, it means you have some wisdom. And we have brought our wisdom, and we want to share it with our younger generations. And seeing here today, this multi-generational participation, it really brings it together and makes us know that this is real community. This is what community looks like. And I appreciate all the folks who have done such incredible work to make this day happen. Those who have worked behind the scenes, who have not been announced and have not remained nameless, but we know that your work does not go in vain. So we thank you all for being here. Thank you for being a part of this. I'm glad that EOC can be supporting this event and other events that we have. And as a shameless plug, EOC is having a holiday party this month on the 21st. It's our Flashback Sunday holiday party, and it will be at the Pride Community Center in Hyde Park at 59 Harvard Avenue. So it's from 2 to 6. There will be some great entertainment. We'll have some fabulous nutritional food, and we're going to have some fun. So come on up and join us. And it's not just for elders. It's multi-generational as well. So if you want to have a good time and mingle and talk to some older folks about what we've done around in this path toward freedom, equality, and making certain that our voices get heard, come up here and join us for the holiday party. Thanks, everybody.
And with that, y'all have a beautiful weekend. Thank you so much. Yes, get home safely.
Don't let us know hit you. Seriously, no, seriously. Have 2 young